right, I think we're ready to get started. So while you're enjoying your meal, I am very pleased to welcome Ed Roth, our Shine director here in this area, to talk to us about Medicare. Welcome, Ed. Thank you.
Masha. Wow, huh? I think this is probably the 9th to 10th year we've gone over your Medicare updates here at the Uxbridge Senior Center, and Marsha's been here every year. Does an outstanding job here at the Senior Center, and you're very, very fortunate to have her. You really are. She does a great job. I'd like to, my name is Ed Roth. I'm a program assistant. I used to be the director, but I'm the program assistant, which is, you know, it is what it is. And, well, what we're going to do today anyway is kind of update you on your Medicare, on Medicare changes and the changes to Medicare. I'd like to welcome Kay Peltier. Kay is working out of my office during open enrollment. And also Marcy Singer. Marcy Singer is your local Shine counselor, and she does appointments up at Tri-River Health Center. And if you need to make an appointment to see her, please feel free to call us at the Milford office, and we'll be happy to book an appointment for you. Talk a little bit more about that. I'll mention that again before I close. Okay? I'd also like to recognize one of your residents here, Phyllis Howell. Phyllis is here with her sister and her table there, and Phyllis worked for many, many years for me up at the regional office and did a great job. I was very, very happy to see Phyllis today. Thank you, Phyllis, for all you've done for Shine. Okay, now, meat and potatoes as we get into the fish. You guys are eating fish. I'm going to talk a little bit about meat and potatoes. Okay, it's Medicare open enrollment season. And that goes from, again, October 15th through December 7th each and every year. And that's the opportunity that folks have to change their Medicare plans. If some of us recall when we were working out there in the corporate sector or wherever we worked, we had opportunities with our insurance plans to change the plan every year. If you wanted to go to a different plan, you could do that. Medicare has the same opportunity for folks. So that's what we're going to go over today a little bit and what the updates are. First thing I want to chat about is Medicare Advantage plans. Medicare Advantage plans are also known as Medicare Health Plans. And basically what they are, they're plans that are established by private companies, and they contract with Medicare to provide you with your health care coverage. Medicare pays these plans, each of these plans, once you enroll, a certain amount of money each and every month to take care of your health care. And from that point on, the Medicare Advantage plan is your primary coverage and not Medicare. So that's the way these plans work. We're all familiar with them in the local area. Fallon Senior Plan, Medicare Advantage Plan, Tufts Medicare Preferred HMOs, they're Medicare Advantage plans, Blue Cross Blue Shield, HMOs and PPOs, Medicare Advantage plans. United Healthcare also has a few HMOs in the area, as does Harvard Pilgrim. And there's a new Medicare Advantage plan in the area, Aetna. Aetna Insurance has a couple of new plans in the area as well. Aetna is a new plan. We're not that familiar with it yet, and we don't have a lot of experience with the network. So you want to be sure, as most of you know, in particular with an HMO, a health maintenance organization, we have to stay in that plan's network. We can't go out of the network. Do everybody know that? Everybody remember that? So we can't go out of the network. We have to stay in the network. So before anybody would join a Aetna plan, I would recommend you make sure that your doctor is in that plan's network so you can be sure to get your services from that plan going ahead. We'll see when they develop a network. I'm sure they'll be around. They're just in Massachusetts this year for the first time, and we might hear more about them during the next open enrollment season. Now, just to look over your present coverages for you may have Blue Cross Blue Shield. They have 3 HMOs, and they have 2 PPOs. There's been a monthly premium increase, a decrease in some plans in some counties, but in Worcester County, we've seen a little increase in the Blue Cross plans. So you got a little statement, a notice in September. It highlighted a little increase if you have a Blue Cross HMO or PPO. And they also have had a few changes in their preferred pharmacy network, and that was highlighted in that notice as well. Fallon Senior Plans, I know a lot of people have Fallon here, and the Fallon Senior Plans, they've changed somewhat. They have a brand new plan, a Flex Enhanced RX HMO. And that plan has a 0 premium. And all counties except Berkshire have that plan. Now, what that plan does, it replaces the old 0 premium plan that Fallon had. It's an interesting plan. It does provide a little bit of dentistry, and it's interesting the way they do it. They will reimburse you for up to $180 in dental coverage for a year. So if you see the dentist, and it's my understanding you can see any dentist, they'll reimburse you for up to $180. But as we all know, if you're seeing the dentist, $180 isn't going to go too far. Okay, so we want to make you aware of that change. And the old 0 plan that Fallon had, that plan has gone up to $17 a month for their premium. Now, Fallon has had premium increases for all of their plans that existed in 2017. They've had copay increases as well, and they have diagnostic services have a 0 copay now, but that doesn't include MRIs. Okay, that's any questions on Fallon? Any questions on anything I've said? You can certainly raise your hand with a fork in it. I don't care. Anything you want to ask, we'll see if we can answer it for you, okay? And if you have any questions, we'll be around after the presentation to answer them if we can. Harvard Pilgrim Health Plan, I don't know if anybody has a Harvard Pilgrim Stride plan, but the emergency room and ambulances has increased on those 2 existing plans, and there's been a couple of small premium increases for their plans. One of them, the lower plan went up $4. The higher plan went up $9. And with Harvard Pilgrim, this year, last year they had a $150 reimbursement for over-the-counter drugs. For 2018, they're going to extend that to both of their plans. So if you get over-the-counter drugs, you can be reimbursed by Harvard Pilgrim for up to $150. So that's a good benefit, Tufts Medicare Preferred Plans, Tufts plans. Tufts plans for folks that Tufts was a big change a couple of years ago. We all remember. My goodness, we struggled through it. When the Fallon and the Reliant Clinic had a little divorce. Okay, you couldn't use your Fallon plan any longer at Reliant, and a lot of folks had to change to a Tufts plan. And we got through that. I remember there was 13,000 people that were affected by that, and there were a number of them right here in Worcester County. So we were able to get through that process, and things seems to have settled in. So a lot of people may have a Tufts Medicare Preferred plan, and just to let you know, there's some increases with Tufts. The HMO Saver RX that has a 0 monthly premium, and this is important. They've increased their out-of-pocket maximum to $4,500. Let me talk a little bit about out-of-pocket maximums, if I can, and hopefully you can get this. All of these plans, these HMOs and PPOs that we're talking about right now, have an out-of-pocket maximum. that out-of-pocket maximum can range anywhere from $3,400 all the way up to $10,000. What is the out-of-pocket maximum? The out-of-pocket maximum is the amount of money that you have to spend in a plan before you don't have any more co-pays or deductibles. Okay, so if the plan has, in this case here, that zero plan from Tufts Medicare Preferred, they have a $4,500 out-of-pocket maximum. So you have to spend $4,500 in co-pays and deductibles before you don't have to spend any more money on the plan. Okay? Now, Tufts' other plan are all $3,400 out-of-pocket maximums. But most plans, unfortunately, they're running into $5,000, $6,700 out-of-pocket maximums. And the bottom line is, to reach these out-of-pocket maximums, when you don't have to pay any more, you have to have a bad year medically. You probably have to be in and out of the hospital a couple of times. Not pleasant experiences. So these out-of-pocket maximums are there. It's a good idea. It's good to have them. But you got to have a bad year even to hit that $3,400 out-of-pocket maximum. So that's what they're about. You see them in your explanation of benefits. Well, I just want to explain it a little bit. So that's kind of important. There's another important highlight with the Tufts plans. Again, that zero plan, this year they're having a 20% co-insurance for Part B medications in their zero plan. Now, Tufts happens to be the only company in the HMO and PPO area that have that's for the zero plan. In the other plans, there's a zero co-insurance for Part B medications. All the other plans have a percentage that you have to pay for Part B medications. And what are Part B medications? Generally, Part B medications are medications you receive in the doctor's office. They can be infusions you may get in the doctor's office, a hospital, or a center. And generally, a lot of these medications are chemotherapy medications. They can be very, very expensive. Okay, they can be very expensive. And if you run into a bout of that, you're going to hit that out-of-pocket cost kind of quickly. So it's with that Tufts plan, if you have one of the other plans outside of the zero plan, you won't have any co-pays for those chemotherapy drugs, okay, and Part B drugs. So that's an important difference with the Tufts plan. Any questions? Good. How we doing? I don't want anybody to choke or anything when I need this. Yes, sir. Person in the center there.
Are there plans that pay 100% of your prescription drugs after you reach your annual maximum benefit? Or do they all have?
Sadly, well, yes, but you can't buy it, and sadly, that's the way it is. No, there's not really. Okay? There's not really. I mean, generally, you can get help a little bit. Pay 100% of the cost of your prescription drugs. If you have a Part D plan, that doesn't exist. You're gonna have co-pays and deductibles. Okay, we'll talk about that in a little bit. Okay, particularly about Part D plans. All right. Any other questions? Okay, good. Okay, United Healthcare. United Healthcare is in the area. They have 3 HMOs. They have a regional PPO. United Healthcare, like any of these plans, carefully check the network, please. You want to make sure your doctor's covered and all your providers are covered if you're interested in a United Healthcare plan. That's very important. We seem to find that sometimes United Healthcare's website has doctors on it that really may not take the plan. I've experienced that myself with my own doctor. So we want to be sure that check with your doctor, check with United Healthcare to verify. Don't use the website is what I'm saying. Make sure you verify with your doctor that they take the United Healthcare HMO. Gentleman talked about Part D. Part D standard benefit for this year. Okay, now I'm going to go over this quickly. First of all, it's a chart, and it's got small print on it. So we're leery of charts with small print, but I'll do the best I can. This is the standard Part D benefit, whether you have a standalone Part D plan or you have a Part D plan that's part of your Medicare health plan, part of your HMO or part of your PPO. So the deductible for 2017 was $400. That's gone up to $405. Now, not all plans have a deductible, and certainly not all plans have a $405 deductible. You know, a lot of plans do have a deductible. Usually in a lot of cases, there's no deductible on Tier 1 and 2 medications. That's the exception. The deductible does not apply. But the plans will all have, the maximum they can have as a deductible is $405, but they have varying deductibles. All of the plans do. So you can take a look at that. The initial coverage limit is 2017, it was $3,700. For 2018, it's $3,750. What is the initial coverage limit? The initial coverage limit is the amount of money that you, the beneficiary, and the drug plan pay before you hit the coverage gap or the donut hole. Okay, that's the amount of money you and the drug plan have to pay. Generally, you're paying the less of that, certainly, and the drug plan is paying the more of it. Usually, because I'll tell you why, the beneficiary in the initial coverage area pays 25% of the cost of the medication, and the drug plan pays 75% of the cost of the medication. So that means that you're paying a lot less than a drug plan is. Usually, in most cases, if you get $800 or $900 out of pocket for your medications that you're paying in copays, you're getting close to that donut hole generally. Okay, so you got to be aware of it. And the Part D plan, whether it be an HMO or the standalone plan, will certainly let you know when you're approaching the donut hole. Once we approach the donut hole, we have to pay 35% of the cost of brand name medications in 2018, and it's 44% of the cost of generic medications. So the cost of your medications will go up if you hit that donut hole. And they'll stay there until you've spent something like $5,000 out of your pocket, and then you go into catastrophic coverage. Okay? Do we understand what I said? I hope so. You guys I've talked to you folks before. So now that $5,000, yes, sir.
How do you know if it's going to be a fixed rate of between 335 and 835, or if it's going to be 5%? Is that in the plan that you can check before you even take it out?
How do you know if it's going to be a fixed?
In other words, it says here on catastrophic cost savings, okay, that it's 5% or
5% of the retail cost of medication, or $3.35 for a generic, and $8.35 for a brand name. Maybe Kay, can you help us out on that one?
Yeah, what the difference is what tier of drug we're talking about. So if it's a generic drug, it would be the $3.35 or $8.35. So probably your tier 1, your tier 2, possibly tier 3, but I wouldn't bet on it. It's your higher tier drugs, your tier 4 and your tier 5, which would be the 5% co-insurance. That's the difference.
So my liability could be as much as 5% of the cost of the product.
Just so you know, too, less than 10% of Medicare beneficiaries hit the catastrophic coverage level.
Oh, I already know.
It's a very, very small number of people who reach that.
Okay? You understand? Some people do. And again, in Massachusetts, again, we have a program in Massachusetts called Prescription Advantage. I know most of you in this room are in it because Marsha's here. I know you're all in it. But that's a very important program that helps folks if they're in the donut hole. Okay? And it's a program that you ought to consider. It's a very liberal program income-wise, and it's something you should consider if you take medications and you're hitting that donut hole. Okay? It's available in Massachusetts, and actually it's available to anybody that has income of less than $80,000, okay, a year for a couple, and I think it's $47,000 or $48,000 a year for an individual. So that's a program that's available to help you if you're in a donut hole. All right? Any questions in a Part D? Thank you. Extra help is available from Social Security if your income is below $1,377. You can get full extra help. And I think the income for partial extra help is around $1,500 or $1,600 a month. That's gross income. With extra help from Social Security, you can get a lot of help paying for your Part D medications. In some cases, as highlighted on this slide here, you'll have a zero premium for LIS members with any one of these seven drug plans. If you're in one of these plans, they're below what you call a benchmark, and you will have a zero premium for your Part D medications, okay? We have some discontinued. We have one discontinued Part D plan. That is a First Health Part D Premier Plus plan. I don't know if anybody in the room had it. It wasn't very popular. I didn't see it come up a lot. But if you did have that plan, you were auto-assigned to a First Health Part D Value Plus plan, and that's what happened. Last year, if you recall, we had a drug plan, a United American drug plan. It was very, very popular, and they just went away. Matter of fact, what they did, they auto-assigned folks to a Silver Script Choice plan. That's a CVS product, I believe. A Silver Script Choice plan. And what happened was this. The Silver Script Choice plan did not cover medications for a lot of people. And medications for a lot of people that had the United American plan were on higher tiers. So in a lot of situations, we did a drug search, and the Silver Script Choice was a lot more expensive than their old United American. And there were plans available that were cheaper for them. So we were able to re-enroll people in a plan that was cheaper for them. So that's what we can do. We do our drug searches, and we want to make sure that the plan you have is the best for you, costing you less money, getting the biggest bang for your Medicare dollar. That's what Shine is all about in a lot of instances. Talk a little bit. Yes, ma'am.
What is Part C, which I now see on the papers?
Part C. Part C is Medicare Advantage plans. That's exactly what we were talking about earlier. Part C is your Fallons, your Tufts HMOs, Fallon Senior Plan, Blue Cross, all your HMOs and Medicare Advantage plans are Medicare Part C. Okay? So that's what they are. All right? Any other questions? Okay, thank you very much. Medicare disenrollment period, that takes place from January 1st to February 14th of every year. That is an opportunity where someone can disenroll from their Medicare Advantage plan and enroll and go back to original Medicare and pick up a Medigap or a Part D. Okay, that's the Medicare Advantage plan disenrollment period. So if you find you're dissatisfied with your Medicare Advantage plan, it's another opportunity outside of open enrollment for you to disenroll from that Medicare Advantage plan. And it does not allow beneficiaries to switch to another Medicare Advantage plan. You can just get out and go back to original Medicare. That's what the opportunity is with that plan. But you can switch to but that's what that opportunity is. Medicare supplement plans. Medicare supplement plans work this way. With a Medicare supplement plan, you continue to have your Part A and your Part B as your primary coverage, along with the deductibles that come with Medicare. And to cover those deductibles, you can get a Medicare supplement plans. That's a MedX Bronze, Blue Cross Blue Shield Bronze, Blue Cross Blue Shield Supplement 1. A lot of people have that plan, and you can get that, and that will cover basically everything that Medicare doesn't pay if you have a Supplement 1 plan. And you can see any doctor you want to see. You're not networked if you have a Medicare Supplement 1 plan or a Medicare Supplement Core plan. Supplement Core plan covers the 20%. Again, Medicare Part B pays 80% of the doctor's cost. You're responsible for 20%. A Medicare Core plan would cover that 20%, but it would not cover the deductibles that original Medicare has. Original Medicare has a deductible in, again, 2017. I don't know what they'll be for 2018 as yet. That information isn't available. But the deductible for 2017 was $1,316 if you were admitted to the hospital. If you were on your Part B, that is a deductible of $183 at the beginning of the year. That was your Part B deductible. And then Medicare paid 80% of the doctor's cost, and you were responsible for 20% of the cost. The final deductible is if you go to a skilled nursing facility or a rehab facility. That deductible, Medicare Part A will pay for the first 20 days in a rehab. But after that 20 days, there's a $164 a day copay for a rehab if you're in there, okay? Also, to be cautious about rehab, we need to be sure that if we're in a hospital, okay, and we get to a hospital, we're in a situation where we're in a hospital, and they ask us and they think we got to go to a rehab, we need to make sure that we're admitted to the hospital and not in the hospital under observation, okay? In order for Medicare to pay that for your stay in a rehab, you have to be admitted to the hospital for 3 overnights, okay? And then Medicare will pay for that first 20 days. If you're in the hospital under observation, Medicare isn't going to pay for rehab. You're going to have to pay for that out of your pocket if you have to go. So be cautious of that. That's very important. That's something we've been seeing a lot, and we need to really be cautious of that. A lot of times we go to the hospital, they're going to see you in the ER, they're going to put you in the corridor. They may even put you in a room, and they can be in there under observation. So you need to make sure you or a family member really can remember to talk about being admitted instead of being in there under observation. Okay, that's very important. Medicare Part B, we're going to have happy to announce, this is one thing I get happy to do every year here. I'm happy to announce we're going to get an increase in our Social Security check. Okay, make that official announcement. Gentleman here is all excited. We're going to get an increase in our Social Security check. That increase is going to be 2%. Okay, we're going to get a 2% increase. What's 2%? 2% is $2 on $100. So that's the way that's going to be. So we're going to get a little increase in our Social Security check. We haven't got one for a while. We didn't get one last. Last year we got a 0.3% increase. It was about 10 cents, I think. I don't know. It wasn't much. But at any rate, but what that means is this. They're going to take it back. They're going to increase your Part B premium. And I think what's going to happen in starting on January 1st, everybody's Part B premium is probably going to cost most people $134. Okay, that's going to be your monthly Part B premium. Now, again, you can get help with that. Okay, Mass Health has a Mass Health buy-in program, and if you qualify for that, and that qualification again is a gross income of $1,377 and limited assets. The assets are somewhere around $8,000. You can't have any more than that in cash in the bank. You can have your house and a car, but you just can't have that kind of cash, CDs, or any of that lying around. Okay, so that's a great program as well. All right, so that's your Part B premium. Moving right along here, see if I can get through this. Oh, my goodness gracious. The next two slides don't apply to anybody in this room, I don't think. Okay, I'm going to highlight it very briefly. If your income is more, if you're single and your gross income is more than $85,000, you're going to pay more. You're going to pay more for that Part B premium. Okay, if your gross income is more than $85,000, they're going to take that and they're going to say, okay, that $134, we're going to tack on an additional 35% onto that, and that's going to be your Part B premium. If you're a couple and your income is more than $170,000, I look around and people are saying that doesn't apply to me. I certainly don't think so. Then they're going to, again, tack a certain percentage onto that Part B premium. So that's called an income-related adjustment, and that happens to people that have higher incomes. I just want to make you aware of it. Okay, finally, almost finally, guess what? I love this subject. This is my favorite subject. We're getting brand new Medicare cards. Okay? So starting in April of next year, April of 2018, Social Security is going to start to mail out new Medicare cards. It's going to be a process. It's going to last all the way until April of 2019, but they hope to get a new Medicare card in everybody's hands. What's changing? They're going to take the number that's on your Medicare card off of your Medicare card, and they're going to put onto your new Medicare card a randomly computerized generated number, okay, that's going to be your new number. Okay, so you can get a brand new Medicare card with a new number on it. Okay, so that's good because it should have happened a long time ago because we have a lot of problems with our Medicare cards today because they have that Social Security number on it, and if that gets in the wrong hands, we got some serious issues. So in order to prevent that, Medicare has decided they're going to change that number and put something random on there that you'll have. Now, guess what's going to happen? If I ask 80% of the people in this room what their Medicare number is, they can probably tell me. Guess what? You get the new card, you're not going to know squat. Okay, it's like your license number. 20 years ago, I could ask you what your license number was. You could tell me. Now I ask you what it is. I don't think there's two people in a room could tell me what it was. So that means you're going to have to refer to your Medicare card frequently. Okay, and it's going to be the same kind of paper that the Medicare card is currently printed on. I have a great fear that people will pull it out, put it in their pocket, and next thing, I got to wash my clothes. See you later with the Medicare card. So what we're going to do what can be done, the new Medicare card, it's my understanding, doesn't have to be signed. Okay, so we can laminate our new Medicare cards. That's my understanding. Okay, so you can laminate them and keep them in a safe place. Carry them if you want to, if you must. But again, that's a plus. You cannot laminate your Medicare cards that you have now. But the new ones, I'm informed that you'll be able to laminate, because we did bring this up a number of times about having plastic Medicare cards, like your health care plan card. Nope, too much money. Excuse me. So you can laminate the cards, is my understanding. Any questions on that? And again, but the important thing is you can use the old card, the old number, until December of 2019. After December 2019, you'll have to exclusively use that new Medicare card and the new number. Also, very importantly, as part of this process, we want to make sure that Social Security has your correct address. Very important. Medicare card is going to mail the Social Security is going to mail these cards to the address they have on record. How do we know Social Security has my correct address? We'll know soon, because every year Social Security sends us some information to us. They send us a 1099, or they send us a explanation of what our Social Security is going to be next year. So if you get that information from Social Security, that means they have your address. If you don't get that information on an annual basis, that means they may not have your address, and you may want to give them a call or go online to confirm that they have your correct address. Very important. If they send it out to some address that you haven't lived at for 5 years, that's going to be a problem, because I don't think they'll be able to forward these things. Okay? So remember that one. That's important. Finally, last two things we want to talk about is the health safety net. The health safety net is a mass health benefit that can certainly help everybody with any of these benefits we talked about, whether it be a Medicare Advantage plan or a supplement plan. And what it is this: if your income is below between 0 and 150%, 150% of the federal poverty level is approximately $1,500, maybe a little bit more. But if your income is below that, you can get extensive benefits from the health safety net, including getting all your services at a health center like Tri-Valley. If you get all your services there, they'll be fully paid for if you have the health safety net. Okay? But again, you have to have full health safety net. Partial health safety net is available if your income is below between 150% and 300% of your federal poverty level. Again, talk to the Shine counselor. Ask us after the meeting if you want any information on that. Finally, any questions? None. Good. One more program. Prescription Advantage. We push that and push that and push that. That is the best program going. If you have a Medicare drug plan, or you get your medications through your Medicare Advantage plan, that's a plan that will help you if you hit the donut hole. That's also a plan that offers everybody in this room, if they're in it, a special enrollment to change their plan during the year. You can run into a problem with some of these drug plans. Some of the plans may state that the price of a medication is this. When you get into the plan year, it changes. They move it to a different tier, or they take it off of the formulary. Anything like that may happen. So we want to be aware of that Prescription Advantage and how good it is for folks. Okay? Before I wrap this up, are there any questions? None? Really? Okay. I'll be around after. Thank you very much for listening, and I hope you enjoyed your meal. Thank you.